I am Ruth the Truth Torres. Let's talk about having healthcare that is affordable, accessible, and puts the consumers in control.
When you're on my website and you see this pink text, that means that there's a link behind that you can click on to see the facts and support for what I'm saying. Did you know that there are 5 million uninsured Texans and that Texas has the highest level of uninsured medical care in the country? Did you know Texas is ranked the 7th worst state for healthcare? I know that far too many people in District 5 lack access to affordable medical care. That makes us all vulnerable to infectious illnesses, affects our ability to work, therefore, it affects our economy and our ability to provide for our kids. Allows illnesses to get worse and more expensive since we wait too long to get care because of lack of insurance. Those on Medicaid and Medicare are waiting too long for appointments, especially for specialists, and driving too far. And access to prescriptions are not equal with our private insurance. And those who happen to unknowingly make a mistake and apply for Medicare benefits too late get hit with a late penalty when they are already at or below poverty level, leaving our senior citizens even more vulnerable. While prescription costs are being negotiated and capped for Medicare recipients, this needs to be expanded to limit drug company monopolies who are price gouging. This is a main reason why our healthcare is so expensive. Monopolies and price gouging. It's just a few companies that control the vast majority of our healthcare industry. And in fact, many of these drug companies are providing the same medicine to other countries for a lot less money than what they're charging Americans for the same medications. We also have a drug and opioid problems affecting our communities. And although there have been huge settlements and grants and other funding programs, those funds, unfortunately, are not being equitably distributed. We need major changes in our healthcare system so we have more access that is affordable so we are healthier. That starts with breaking up the monopolies and the price gouging of those controlling our health market. We also have to stop the privatization of our medical systems, especially our hospitals that are focused more on profits than quality care and have reduced our facility capacity, especially in our rural communities. We have to get creative and design programs and access to providers using medical care units and the internet, which is why President Biden's infrastructure bill is so critical. It won't solve all our medical access issues, but it will allow people to have access to doctors via the internet for virtual visits. That's why I'll work for Medicaid expansion in Texas and the regulation of prescription drug costs and improving Medicare benefits with vision, hearing, and dental coverage. I support a single payer program to strengthen the Affordable Care Act and expand the Family Medical Leave Act. Consumers need to be in control to add whoever they want to their plan, regardless of age or any family relationship restrictions. It shouldn't matter. We're paying for the plan. We should be able to put whoever we want to on our plan. We also need equal access and quality of care for Medicare and Medicaid patients. Doctors shouldn't get to limit how many of these patients they see every month, which is what increases our wait times to see specialists. We need to have equal care in our prescription, our providers, and our treatment plans. I'd like to see a pilot for ACA programs for businesses to have the option to get out of healthcare management by giving workers designated funds they can only use to buy medical benefit plans on the exchange or from a co-op. That way we can get businesses out of our medical care business. They can just operate their business. We need to also look at adding preventative and health trajectory education programs and promote co-ops and other programs that unwind the monopolies in our healthcare system. We need to ensure equitable distribution of funding for drug rehab and recovery programs because the people of District 5 deserve affordable and accessible healthcare with more consumer controls and education to have longer, healthier lives.
Thank you for taking the time to talk with me. Please connect on social media, subscribe to the newsletter, and sign up to volunteer on the Get Involved page above. I look forward to connecting with you and seeing you vote for Ruth the Truth Torres for U.S. Congress, Texas District 5, allowing me to work for the policies you deserve.